This is the second video response about coronavirus outbreak. First video that I made at the beginning of February was a general superficial overview of a situation in Ukraine, discussing how streets look, how people feel about the coronavirus, and how foreigners feel about it. If they feel like Ukrainian healthcare system can take care of the situation in case if it escalates. I wanted to know if foreigners feel safe, if they know what to do in case if they get sick, what is the general mood in the country. And my main message was that Ukraine has bright medical professionals, that foreigner should ask local for help if he needs medical help, and that we should not give in to panic easily, because we do have herd mentality, I think, and we should not panic easily. Personally, I felt like a little bit some congestion in my throat. Sneezed a few times, and then that escalated in my mind to the fact that I might die soon. So the media and all these conversations make us really stress us out. I consider myself very emotional and in some cases acting really irrationally. So what I want to say in this video is that a few days ago, at the end of February, there was a first case of coronavirus registered in Chernivtsi. It was a couple that returned from Italy. A husband had flu-like symptoms, went to doctor, went back home, and the symptoms escalated. Then at the epidemiological center, he did his labs. They returned positive. So he officially now, it's his first case of the coronavirus. But his condition is pretty mild, and Ministry of Health said he could even be at home. So it's not escalating. So, and his wife is also quarantined in the apartment. Now the government is working with everyone who this family has contacted to prevent virus from spreading. Also, you know that we had strikes throughout the country in February, starting from 14th of February, and on the 20th of February, the riot against Ukrainian citizens being evacuated from China. Government was thinking where to place them for quarantine, was considering Lviv, was considering different regions, and decided to place them in a secluded location in Poltava. So we had a stressful response from citizens who were rioting, but now the quarantine is ending, the people will be released soon, and also inhabitants of these locations are being also monitored closely for flu, for symptoms of coronavirus. There were also block posts in other regions of Ukraine. One airport refused to accept a plane from China. Also about Diamond Princess, there were 3 Ukrainian citizens that were treated in Japan, and everything is well, and soon they will be released, from what I researched. Government has created a website where it publishes official information about coronavirus, and it encourages people not to spread any false information to prevent the panic, and I absolutely love that. According to the Ministry of Health, there are 12,000 beds in infectious hospitals, 2,000 infectious doctors, and 5,000 medical personnel. Right now the government purchased coronavirus tests to check 960 people, and if needed, more tests will be purchased. These tests are being sent to a lab in Kiev by a specific unit in epidemiological departments in each region. So virus reference lab conducts the testing. Government insisted that people should not wear masks. The problem is that we are out of masks, and the people who need them, like surgeons, do not have them. Only if you have flu symptoms you should wear it to prevent other people from getting sick. So I could not get a doctor to do an interview with me, especially if they work for a government structure. But the information I got is that there is a special epidemiological team and emergency vehicle that is dispatched if a patient has symptoms of coronavirus. So people who have symptoms are not invited to go to the hospital to prevent the spread. Also now there is a flu season in Ukraine according to Ministry of Health, and so this interlaps with this coronavirus outbreak. So what people might be feeling is the flu symptom. The fact is that we already had 40 people that died from different forms of flu. Basically, doctors are very calm and they are very confident that the government, the country is ready and prepared to respond to the outbreak. What people unofficially say is a very different story, but I prefer to stick to the official government information, because it's really true that we have extensive infrastructure and we do have many medical professionals. What I do know is that the healthcare system is mismanaged and the funds are mismanaged. But I believe that government now stepped in to control the virus. At least the communication that I get is, I like it. It makes me feel calm. The training of medical professionals by government just started at the end of February. The training of doctors or emergency response team, which makes me doubt how well they are prepared. So if you're a foreigner and you have posvitka, so you have official permission to stay in Ukraine and all your documents are done, then you go to your family doctor of your polyclinic and you sign contract with the doctor, and this is your GP. Most foreigners that I know of, they have a local accompanying them, either if it's their friend or wife or anybody. When I went to the polyclinic at the reception and I asked how foreigner can get help, they did not know the answer, and they just referred me to the family doctor. So basically all the responsibility they laid on the shoulders of the family doctor. If you do not have posvitka, if you are here on any other grounds, then I am at the Lviv Regional Hospital now. You should go to see a doctor here, where you see on the video footage. I have pretty strong nerves, but even for me it's a little bit stressful to come here. It's old building, and so you should bring somebody with you, a translator, because they do not speak English, doctors, and you will need a translator. In case of a COVID virus, they do not deal with it at all, and it's sent to the epidemiological hospital. There are claims that the government is not ready to really handle the outbreak of the virus in Ukraine. And I will not discuss it. I will stick to official published information on the website of the Ministry of Health. And Ministry of Health is calm, that is prepared to handle the situation. And I think we should not be worried.